Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of other leaders. On this podcast, we will share stories from many leaders in all medical specialties to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome to the Lead Change podcast. It is a huge pleasure to have my very good friend, Dr. Berte Boe, here as our guest on the Lead Change podcast. Dr. Boe is a consultant orthopedic surgeon with a special interest in complex shoulder and knee surgery. She is head of the Arthroscopy section at Oslo University Hospital. Dr. Boe earned her PhD in orthopedics from the University of Oslo in 2012 and has since authored numerous scientific papers in clinical research, as well as several book chapters. She is a sought-after speaker and has been invited to present at both national and international meetings. She contributes as a faculty member on topics related to both shoulder and knee surgery. Dr. Boe currently serves as the second vice president of the European Society of Sports Traumatology, Knee Surgery, and Arthroscopy, also known as ESSKA. She's the first woman to serve in that role. And she is the past president of the Norwegian Society for Surgery of the Shoulder and Elbow. She is an associate editor of JISICAS and serves on the editorial board of AJSM, KSSTA, the AJSM Electronic Media Board, The Hive, and the Video Journal of Sports Medicine. Additionally, she is an active member of 3 ESSKA committees and a committee member of the European Society for Surgery of the Shoulder and Elbow. Berte and I met in 2022 when I did the AOSSM Traveling Fellowship to Europe. She was one of our hosts when we visited Oslo, and we became fast friends. We have become very close over the past few years, and fortunately, actually, we have the chance to see each other fairly frequently at sports medicine meetings around the world. I am so excited to have Berte here with us today. So Berte, welcome to the podcast.
Thank you so much, Mary. It's very, very nice to be here. I appreciate that I can be one of your guests.
So yes, thank you. And I'm really excited to dive into all aspects of leadership and experience you've had in your career. So before we really get into some of those details, though, can you start by telling us a little bit about your clinical practice, meaning what are your specific areas of interest and clinical expertise?
Yes, I have been working with shoulder and knees since I was a resident. I became a consultant in 2010. The educational system in Norway is that you do not specialize until you're done with residency. So when I was done with the residency, I met with 2 of those persons who have later become my mentors, Tom Ludvigsen for shoulder and Lars Engebretsen for knee surgery, and started to work in the section that the 2 of them founded in 1996 together. So maybe a little bit unusual to be in Europe and to be in Norway to have that combination. But the reason is that Lars Engebretsen worked for many, many years in the US. So when he came back to Norway, I think he wanted to start a section that was built on sports medicine like you do it in the US. So more normal in Europe and in Norway is that you do only knee surgery or only shoulder surgery and do everything in one joint. But that's the reason why I still do both knees and shoulders, because I'm not able to leave one of them because I very much enjoy both of them. But I don't do arthroplasties and fractures in knees. I do sport, ligaments, meniscus, cartilage. And for shoulder, I do everything but fractures. So actually, of course, I can do a Bankart fracture or a small tuberculosis fracture, but mostly sport, but also arthroplasties in shoulder. So that's the reason why I'm doing 2 joints, and I really enjoy it. So I don't think I will be able to leave one of them.
No, and you shouldn't. And thank you so much for providing that clarification. It actually has been quite eye-opening to me as I, met you and have met others in Europe and South America and come to learn that really sports medicine outside of the US is largely knee surgery. And I'll share with everyone, Berte, I was the first host and first faculty member that we interacted with on our traveling fellowship who did both shoulder and knee. It is very, very rare in Europe. And so it was wonderful to share that experience with her, because that's exactly what our practices are like here in the United States. So Berte, you have served as the head of the arthroscopy section at Oslo University Hospital since 2022. So what are some of your main responsibilities in that role? And do you have specific goals for your section?
Absolutely. I feel a huge responsibility when I took over as head of that section. As the two who started the section, I admire a lot. And everybody knows about Lars Engebretsen because he has been so much in the States. He has been very famous in Europe, and he's been a previous president of ESSKA and everything. I saw the way the two of them were leading the section, and I saw how they managed to build a team with everybody dedicated to do sports medicine surgery and also a lot of research. Sometimes you might have the imposter syndrome and think that how can you even try to fill these shoes? But you get more confident with the years going by, and you also realize that you have to do it your way. You cannot be a copy of those stars. So I had those years working in the section, and then there were 6 years with another leader taking over for Tom Ludvigsen, my very good friend and previous boss, Sverre Løken. He is a very hardworking, very nice guy who taught me a lot about another way of being a leader. So I learned a lot from those before me. And so when I entered the role for almost 4 years ago now, there's one thing I really, really wanted to continue working on, and that was building the team. You cannot do this alone. Even if you're chosen to be the leader of the team has to be working even if you are not there. And you have to encourage everybody on board to do their best, because if there's just 1 or 2 stars, it will not work. You have to encourage everybody to be what they can be, the best version of themselves. Yes.
Yeah, I think that's incredible. And despite our many, many conversations, I don't think I've heard really you lay that out and kind of describe that transition and what you learned from the leaders before you in that position and what your goals were as you took over and what you've done serving in that role for these past few years. I think you raised some very important points about lifting everyone up, working to everyone's strengths. And I have met many of the surgeons in your group, and I can see the benefits and of that support from the top down, from your leadership, and that everyone gets along and works very well together. So that's really wonderful to see that in action. Now, Berte, you also have a PhD, which I think is absolutely incredible. And that also is another little bit of a difference between maybe European surgeons or outside of the United States and within the US. So can you tell us, when did you get your PhD and what did that focus on?
It started actually when I was very young resident in a small hospital called Diakonhjemmet Hospital, also based in Oslo. I was young and I was a woman, and there was a lot of older men in the department, and some of them sent me comments that, okay, you look good, but you can't do surgery. So that kind of made me wanted to prove to them that it was not just the look, and it was not just that I wanted to be in the OR. So I thought that one thing I can do is to read a lot, to read orthopedic papers, to know the science, to know the literature behind why are we doing this. And in that hospital, they did a lot of hip arthroplasties. So that was one of the early procedures that I learned and did many procedures of in the beginning of my residency. So I started to read a lot about it, and then I came in contact with a professor from the University Hospital, Lars Nordsleten, and he asked me if I wanted to participate in research. And they had actually started a project because the University Hospital collaborated with the small hospitals to include more patients. Then I was responsible to include patients to this hip study in my small hospital, and I did really good. So I included a lot of patients and followed them carefully, and then he offered me to be the first author and to finish this randomized controlled trial comparing 2 different hip arthroplasties. And I learned a lot about RSA, which is a very complex radiologic program to compare these arthroplasties. And because my interest in research, when I had done half of my residency, or a little bit more than half of the residency, I was offered a position at the University Hospital. So very early, I understood that this could give me some respect and also maybe positions in a bigger hospital. And for me, it was very interesting to combine both the practical things in the OR, the science and the theoretic behind. So I really enjoyed it. So also when I switched positions from this small hospital to the University Hospital for 2 years there, I had 50% clinic and 50% research. So this, of course, was a huge step towards the PhD, because PhDs are a little bit different also from country to country in Europe. But in Norway, it's supposed to be 3 years of full-time work. But many doctors do it in the evenings or in their spare time. So then, of course, it takes more than 3 years. So all the time I did it in addition to full-time residency and full-time work. So it took me between 5 and 6 years to finish. But then I could defend my PhD in 2012. So I was very happy with that. If you remember, I said I started working with sports medicine in 2010. So I have to admit that the last 2 years were a little bit opposite. I wanted to read about all the procedures and stuff in sports medicine, but I still had to finish my thesis. So I look at the PhD as education in research. You learn how to write a paper, you learn methodology, you learn how to discuss your results and to write and publish, which is very important in any kind of medicine. So even though my PhD is in hip arthroplasties, I learned a lot.
Yeah, that's an excellent story, and interesting to hear how that all progressed. And you make a great point that although the PhD wasn't in the topic necessarily or the area that you specialize in, you still learned a lot from that process. So, and that, of course, is the most important thing. And kind of continuing on with that, how do you use some of the skills and the just general knowledge base you gained throughout that process of obtaining your PhD in your career now?
For me, it was, I feel it was the beginning, and I wanted to do more, and I had learned a lot that I wanted to build on. So I continued doing academic work, and parts of it is teaching medical students. So the medical students in Norway, they have to write a very small thesis, not a PhD, but a very small thesis. And then they need somebody to supervise them. So I've had several medical students coming to me and said that maybe very often it's built on some diagnosis they have had themselves. If they have had an ACL injury or if they have had a slap tear or something, they want to write about it. So then it's my job to supervise them and to show them how to do that and to give them feedback of what they have written. And some of them want to see some patients and interview some patients, and some of them just want to do a literature search. So I discuss and have meetings with them how to proceed. And then of course there are residents in my department who either want to do a small project which they can present then in the annual meeting, like a small abstract of maybe a patient series, and then there's people who want to have a PhD. So at the moment I'm supervising 3 PhD candidates. It's not like you get any education in how to supervise those candidates. So of course much of it's built on what I have done myself, and also part of my PhD is some courses on how to do the methodology and some statistics. And after my PhD I have taken some other courses arranged by the university on how to supervise PhD candidates. So I'm trying to use what I have learned and trying to encourage other younger colleagues to go into research. And that also reflects how I try to build the section, because this is linked to my position as head of the section. And when you have people want a job in my section, I try to award if they have done some research by giving them the position maybe before another candidate who did not do research. Because I think that we have to give something back. If not, maybe people will not spend their time on research. And if they never start, they will never know how much it can give and how interesting it is. So you have to encourage them to get into it.
Yeah, such great points that you raise. I mean, what you were just ending with, I agree completely, right? If you have never tried or participated in the research process, you maybe are a little bit nervous and don't understand what you need to do, but then also you don't understand the many benefits, as you said, and how you can contribute to the field, how we can contribute to care for our patients, really ultimately is what we want to do. And also great to hear that you have the opportunity to help supervise, encourage, and support medical students and residents in these fairly large research endeavors, these research activities. So that is great. You certainly are using many of those skills that you gained. And I also love to hear that you've continued to build on that by taking some classes that are offered at the university. So that's awesome. I think we never stop learning, whether it's with regards to research or with, in our clinical practice with surgical skills and new techniques, we are always learning. So I want to dive into some of your other important leadership roles. You currently serve as the second vice president for ESSKA, and you will be the first woman to serve as president of the society. So huge congratulations. I am so excited and so happy for you. Can you share with us, too, what was your involvement in ESSKA leading up to your selection for the presidential line?
Thank you very much. Yes, I remember how it started, because then we have to go back to me working with Tom Ludvigsen. He was the one who said that I should send in abstracts and try to start to come to ESSKA congresses and meetings. So in one of these meetings, he introduced me to Giuseppe Milano, who was then the chair of the shoulder section in ESSKA. And he asked me if I was interested in doing some work for the shoulder group. So I was then put in the communication committee of the ESSKA shoulder group. And I met, among others, Maristella Sakamono, who has become a very good friend also. So we started to be the communication committee. And one of the things we did was posting things in social media. So we tried to find interesting papers and try to take pictures of people who were presenting and stuff to have something to post every week for the shoulder group. So that very, very beginning. And then I was also invited to have some presentations in the ESSKA congresses. And it was actually Tom also who proposed me to do a debate about the rotator cuff, either to operate or not for the small tears. And I had the task to argue for non-operative treatment. And I had a lot of good studies to present. It was a 30 minutes debate in ESSKA in Glasgow. After that debate, Bruce Ryder came to me and asked me if I wanted to do reviews for AGSM. And at that time, I hadn't done any reviews. So I was like thinking, I don't know if the things I do will be good enough for AGSM. But he convinced me to try, and I continued to do it. And after a little while, I was asked to be in the editorial board. So I think he was happy with what I did. And Jon Carlsen heard this, so he said, you shouldn't be doing for AGSM, you should be doing for KESTA. So then I started to do reviews for KESTA and also was invited to the editorial board there after a short while. So I think this is actually how it started, because then, and before the Congress in 2022, Jon Carlsen, among others, were discussing who candidates for the ESSKA board. And I know that he proposed me because of what I had done for KESTA. And there were some other guys in that board who maybe knew who I am, but not the presidential line, and not many of them knew who I was. So they had to call Lars Engebretsen to ask if I could fit in a board position. So Roland Becker, who was the upcoming president, I had never met him before, but he was emailing me and asking for an interview. So we did the interview in Zoom, and I remember very well when he called me to offer me this position, because I was skiing. So I didn't answer the phone. And then when I stopped to have a little to drink and have a chocolate during my cross-country long trip, I saw, oh, Roland Becker called me, and I didn't answer. So I texted him back, because you don't want to stop talking the phone when you do cross-country skiing in very many minus degrees. So I texted him back that I was skiing and hopefully I could call him back later. So I did, and he offered me this position. Of course, I was so excited about it, and I had hard to believe that this was going to happen because admire those people who was in the board, and I very much would like to do it. And I was surprised. I have to admit, I was very surprised. But so then I entered the board in 22, and I get to know these people. They're all very nice. I was very happy being the vice general secretary, working closely with the general secretary Carl Eriksson, who has become a very good friend, and thinking about the presidential line. I didn't even think about it. But then, of course, when it comes to the next Congress, we started to discuss it in the board, who was going to be the second vice president candidate. And there's a nomination committee, and people started saying to me that you should apply, you should propose yourself to the second vice president position. And I was a little bit, I didn't know what to do. But then Jacques Menetray, who was the past president, he came to me, and we were actually walking to a dinner. We like to walk to dinner to get some exercise. So we put on sneakers and we were walking to a dinner who took us like 40 minutes or something. And he came to me and said there was something he wanted to discuss, and he encouraged me to apply for the position. And my first question to him was if he really thought that would be possible, because there had been no women and there were a lot of other strong candidates. So, but he encouraged me, and then they ask all the members. So all the members can vote and suggest a candidate, and then it's the nominating committee who take the decision, or they present the 3 best candidates to the board, and the board votes. So in the December meeting, I was sent on the corridor during that board meeting because they were going to vote and discuss the 3 candidates, and I was chosen. So I was very happy, and I feel very humble about this position. And I think it's an 8-year commitment, because you're 2 years second vice president, 2 years first vice president, then president, and then 2 years past president. So when people said that you are going to work in 8 more years, I was thinking that I'm happy it's 4 years until my presidency, so I can learn a lot from the others before I'm there. And you know, when times goes by and you are involved in these important decisions and you go to those board meetings, I learn every minute. And now it's been 1.5 years in this position, and I feel I'm getting there. I will be ready.
You will be ready. I know you will. And it's great to hear how that all came to be and how you've evolved in that position, and that you are learning all the time. You learn from being involved in the board meetings, the meetings in between, the big board meeting at ESSKA, and all the interactions that you have as a team in between that. And you get a lot of information about the inner workings, kind of behind the scenes of what's happening and what is to come in the future, because certainly there's always a lot of planning for the future. So for you personally, what are some of the initiatives, I guess, that you hope to move forward during the rest of your term in the presidential line?
There's one obvious thing that I can start with, because I have to mention that. And we have started the initiative called Women in ESSKA. So as the first woman president, of course, this is a focus for me. It's a delicate balance, because you don't want to be the one who's always talking about diversity and including women and stuff. But I'm very, very happy that we have successfully started this initiative about women in ESSKA, because in the Scandinavian countries, there are many women orthopedic surgeons now, but every time I go abroad, I see that we need it for the rest of Europe, and we need it for the US and other countries as well. Not to mention India, where we both went to see and learned that it was 0.3% women orthopedic surgeons. So this initiative started actually back in 2022 at the Congress. Then we had a roundtable event, and also another gathering in 24. And what I have been responsible in the group is the mentor-mentee relationship and a traveling fellowship for young women. So my suggestion was that 2 of them was gonna travel together, because then they also have the advantage of get to know each other, and they could also maybe rent a small apartment together instead of renting an expensive hotel room, because they get an amount of money sponsored by the industry, We were very lucky to get funding, and then they can choose whether they want to stay 1 week or 2 weeks. So what ESSKA does is to match the mentees and the mentors, and they can make a wish of 3 different mentors, and they also make a wish what they want to see, if it's knee, shoulder, foot and ankle, or hip. So I had 2 visitors, Chiara and Maiti, in May, and I was hosting together with Mette Andersen, who's also very active in ESSKA in foot and ankle. So we shared that I had visitors for 1 week, and then they traveled up north to Tromsø, another city in Norway, and spent 1 week with Mette. And we think it was a huge success, and I think also the mentees liked it a lot. And we had 1 round in the spring, and we're now having 1 more in the autumn. And when I see the result of this, I know it's important work, and I'm very happy that we were successful both in getting funding and being able to arrange this. So, of course, this has been an important initiative and task for me. And also, it's not only about women, but I also really want ESSKA and other societies as well to build bridges across borders. So when we compose both the groups within ESSKA and the board and the program in the Congress, we try to include people from all countries all over. And we also try to include shoulder, foot and ankle, and hip surgeons, sports medicine surgeons in ESSKA, because traditionally ESSKA has been a very strong knee association. So for me, doing both knees and shoulders, it's important to be attractive also for people from all countries in Europe and also outside Europe, and for people doing other surgery and than just knee.
Yeah, I love that. And you started with Women in ESSKA as a very important initiative, which, I mean, I agree. Like, and it's been fun from my perspective too to see an evolution in that group. When I was at the ESSKA Congress in 2022, there was a very kind of small gathering of women in ESSKA, and there was a symposium, and so this sort of the initial groundwork was laid for women in ESSKA, and then we see, you know, this traveling fellowship you're talking about now. And I am actually so excited to share, and you probably know this. So I'm going to be hosting 2 mentees from ESSKA in November. Actually, they're going to come, and I am so excited to have them come and visit and to be included as part of this group. It is really tremendous. I can't wait to share the experience with them. And everything I heard from the traveling fellowship in the spring, from your personal experience and others, was that it was hugely successful. So congratulations on coordinating this like massive effort. There's definitely, I know, a lot of work that went into getting support and sort of laying the initial foundation for making this happen. So I can't wait to see how it continues to kind of grow and evolve.
We're very excited about it.
Yeah, it's fantastic. And as we grow in our own careers, you know, I think that we are constantly refining our own leadership style. So how would you describe your leadership style, and in what ways do you find that to be effective with the teams that you work with?
I think that people in my group would say that I'm direct and open. I don't try to have any secrets for them. So if they ask me my opinion, they get it, even if it's maybe something sharp or negative. But I don't feel that I'm very strict as a leader. And it's very important to me to include all my colleagues' opinions. So, for example, if we are to change our methodology, or if we are to decide who is going to do this kind of procedure, or how we organize when to meet for the section, I try to discuss with all my consultant colleagues, but then I understand that there might be different opinions, and it's my responsibility to take the decision. So normally it's not a lot back and forth with me. I don't have to think long about stuff. Normally I take the decision and concludes in a short time. And that's my personality, I think, because I can see I do that also in private, but that's something I also then bring to work and to my way of doing leadership. And I think it's important to sit down and talk with your colleagues, having a chat, and give them the opportunity to talk to you both around the lunch table, but also to come to your office if they have something in mind that they want to discuss. And as the head of the section, especially for younger ones, but also for experienced colleague, you have to be there when they need to discuss a case. We are not working in private practice like you and many others are. We are a team in a public hospital. So if we have a challenging case, many of my colleagues would like to discuss that with others. And we have organized, so we have one meeting every week with a radiologist with us in the room. So we can discuss difficult cases that we have seen in clinic that week. For both experienced and younger colleagues, they can get the feedback from the other colleagues and from the radiologist if we need that. Our advice is how to handle this case. So I think that's a very important meeting point for us. And we also have another meeting point in the morning once a week where one of us are responsible to bring a case. And it might just be the case from the day before if you struggled with something or if it was something special that you want to show to your colleagues. To build a team, I think it's important to have some of this small meeting where we all have 30 minutes, maybe 45 minutes to sit down and discuss cases and talk together. I also have had some focus on trying to build a group with some diversity. So there are some older people and some younger people, and both genders, of course, because I think that's nice for the group. It's then my responsibility to try to combine teams in the OR so that the younger one can learn from the older ones. I do the schedule for all the doctors in my team, put them together in the OR and decide which day they are in clinic, which day they are in the OR, which day they are doing the round. And so it's a bit of organizing, but I'm also very open to feedback from the others. So I think I'm sometimes strict, sometimes mild. And when I'm not the one to judge how I'm doing it, but I feel it's a very nice group, and I think that we are enjoying every day. So I think I would have noticed if somebody didn't like my leadership style.
Right. Absolutely. And I think that what you're getting at is that you kind of adjust to the situation that you're in. And you're able to adapt to sort of deliver information, to get the group involved, to have them contribute to decision making. And I love too what you were mentioning about having these specific interactions for your team and how important it is to bring everybody together to talk about difficult cases and to divide them up when they're working on or actually performing cases, so that the more junior surgeons learn from the more senior surgeons. And that's an incredible way to learn. And I'm sure that they really appreciate that, and that you're thoughtful as you approach those situations. So that's fantastic, Berte. Thank you for sharing. I did want to ask you about one other leadership role. So you served as president of the Norwegian Society for Shoulder and Elbow Surgeon. What did it mean to you to serve in that role, and what did you take away from that experience?
Yeah, that was a possibility to have impact on what was going to happen in the Norwegian meetings when it came to shoulder surgery. We are an association for both shoulder and elbow surgery, but of course I don't do elbows, I do shoulder surgery. So it was mostly focused on shoulder surgery, but we also always had somebody in the board who did elbow surgery. So many of the tasks, being the leader of that group, was to arrange symposia in the Norwegian Orthopedic Annual Meeting. And we also have an annual meeting for the Arthroscopy Association. And what you learn in that role is to use your contacts, because you want to invite some attractive international speakers and you want to combine them with skilled Norwegian speakers. And you learn how to build a program, how to plan a symposium, what's important. Maybe that was something you had to do every year, because this was a 4-year commitment. I could have stopped after 2 years, but I enjoyed it, so I did 4 years.
Kept going.
Yeah. And so I really liked that. And then we had a Nordic shoulder and elbow meeting, so we were responsible for arranging that meeting. And then you learned how much work it is to arrange a meeting, because we didn't have. It's a small association, so it's not like we have an office doing the work for us. So we were like secretaries and everything when we arranged that meeting. So you have to learn both to structure yourself to organize the meeting, and you have to learn to delegate some tasks to others, because if not, you drown in work. And you have to cooperate with people who maybe think a little bit otherwise than you, and you have to handle that people are not always responding to your emails.
Really?
So that was a small association where I learned a lot of this stuff working for an association. It was also something that Roland Becker noticed when he was interviewing me about the board position, because he was asking a lot about my experience working for an association earlier. I think he wanted to make sure that I knew what that would mean or work.
Yeah. Yeah. And I think I love the very important points that you raised and some of the truly like hugely valuable skills that you gained in terms of delegating and cooperating and collaborating and understanding that some of these challenges, some challenges that in a smaller organization, right, you face where there's not as, not a central team, there's not a lot of administrative staff. So a lot of that fell on you guys. And so you learn a lot of valuable skills. It also helps you understand what happens behind the scenes at bigger organizations within ESSKA and within ESSKA, and how helpful the staff are by helping to manage a lot of those things. But that experience and the skills you gained certainly, I'm sure, have been hugely helpful as you've stepped into the presidential line in ESSKA. And so wonderful to hear how that kind of laid a foundation. So couple of final questions for you, Berte, to round out this excellent discussion. So I wonder, have you read any leadership books that you've found particularly impactful or influential to you?
I have read a little bit about leadership. There's one book that was recommended to me from two other powerful women. The title is a little bit ironic though, because I don't think it's translated to English, I'm not sure, but it's Scandinavian and directly translated from Norwegian. It's called Surrounded by Idiots.
That's fantastic.
That's a very arrogant title, but this book is about the different personalities. So it's about how you as a leader have to learn to cooperate with all different kinds of personalities. So in this book, it's tried to make simple by dividing all persons into red, blue, yellow, or green personality. And then shortly explained, it's red is a dominant personality, blue is the very systematic one, loving Excel sheets, yellow is inspiring, and green is diplomatic. So the whole book is about describing the different personalities and how they will react to different situations. So if yourself is a blue personality, it might be very difficult for you to cooperate with a yellow because the personalities are crashing. So this book gives a lot of examples and gives a lot of information about the different personalities. And for some red or blue person, it might be very difficult to understand how relaxed maybe the green one is when it comes to competition, for example. That some people are just loving to have straight lines and Excel files and every answer is yes or no. But there are other people who never can decide yes or no, or there are always something to discuss. It could be like that, it could be like that. So yeah, so I had a lot of fun reading that book. But I also learned a lot because maybe you don't think of how different personalities react to different situations.
So important. And I love that. And I would say that I would read that book because I'm sure it would be of interest to me, but I can't read Norwegian. So just going to be honest about it. So I'll take the lessons from you, Berte. But thank you for sharing.
And I also, a year ago, we had a new head of the whole orthopedic clinic. In the beginning, he sent some papers about leadership. So one of the papers he sent was called "Ego is the Enemy of Good Leadership." And this was published by Harvard Business Review. And I also find this very interesting and entertaining. When you become a leader and you get higher in the system, you might meet more and more people who admire you and to give you compliments, and they feel they can even be starstruck, and this tickles your ego. So if this goes to the head, you will not be able to take the same decisions and maybe be neutral. So one of the important things is to talk to the people that you are working with and not let the ego come in front of the organization or the department. Because if you just think of your ego and maybe just sit in your office and don't talk to people, then you will totally fail as a leader. So it's very important, I think, to have lunch with everybody, to have an open door in your office, and not just be in your office thinking of your ego, but be out there with all the people.
Yeah, that's a really important point, and I'm glad you brought that up. And Harvard Business Review has a lot of excellent articles related to leadership. So I'm glad you highlighted that one. But it's a really important point to make sure you engage the team, but get their feedback too. What you're saying, about all things related to the team, but also you're curious, like, any feedback related to what you are doing as a leader, how that's effective, how it's being received, and always being willing to accept that feedback and to make adjustments as needed. So I think that's a great article to highlight. My last question for you is, do you happen to have a favorite quote?
I do. The one I always come back to is, believe that you can, and you're halfway there.
That's excellent. I love that.
Yeah, I think I remember this one because I have so many times thought that, especially women, invited to do stuff, encouraged to do stuff, and they think that they're not good enough or they will not be able to do it. So I try to say to everybody around me, believe you can, and you're halfway there.
Yeah, that is great advice. I hope everyone listening takes that away. So, Berte, thank you so much for being on the podcast. It is wonderful to see you and to connect in this way. I've really, really enjoyed talking with you about your leadership journey. Congratulations again on being the first woman in the presidential line for ESSKA. And thank you so much for sharing your insight and advice. I'm really looking forward to catching up again sometime soon.
Thank you very much for having me, Mary, and congratulations on this awesome podcast. I enjoy all the episodes.
Great. Thank you. I really appreciate that. All right. Take care, Berta.
Take care.